So now with active acne, there's so many options. As you've talked already, we know that there's fantastic pharmacological interventions. We truly have energy-based devices that can work. We have some that are common. We use something called a 650 microsecond Nd:YAG. It works incredibly well. There's no consumable. We just switch the spot size from a 6 millimeter to a 2 millimeter, and we can literally shrink that individual lesion. So it's a great addition to anything that we're doing, both orally as well as topically. We have other things like AviClear and the competitor that's out there. So we know with that particular wavelength, we're not just talking about a short-term result, we're reducing the size of the sebaceous gland, similar to what we can do with isotretinoin, which has been a game changer for what we can do. The question becomes, is it in the right hands? Is it something that's tolerable? And is it cost effective for the patient as well as the practitioner? So I think those are the questions that we pose for ourselves. For me in practice, I'm an impatient person in general. I'm a surgeon by nature, so I want something that's fast. But at the same time, I'm a business owner. So I want to make sure, is it something that me as a business owner can afford? And can I pass on that cost to the patient to really give them that wow to the point where they see a value in that treatment that's there? Most times I'll see somebody within about 2 weeks after they start their topicals, and we can kind of clean up what the aestheticians call purging. I hate the word, but
Yeah.
but in TikTok and social media, they always talk about purging. So at that 2 or 3 week mark when they're seeing the purging, that's when I go ahead and treat them, and we can accelerate their results. And at the end of the day, as a dermatologist, I need to have that patient trust that I know what I'm doing. So when I tell them ahead of time, in 2 or 3 weeks, come back in, we're going to do a complimentary treatment or we're going to charge X number of dollars, we know that they're going to start building trust and they'll continue with the topical or the oral medication. I love when patients have a more accelerated timeline because we have fantastic devices. So I'm going to name 3 off the top of my head. One is a device called Aerolase. That's that 650 microsecond Nd:YAG laser, safe for all skin types. When you first heat the entire skin, because it's putting so much energy in, but there's not a lot of collateral damage because of the short pulse, we're going to improve that overall destruction of bacteria. Really, you're killing off the bacteria. Then when we switch to a more focused spot lens, like a 2 millimeter spot lens, we can go after those individual lesions, and you'll see a change within 24 to 48 hours. The second one that I use on a regular basis is a device called Advilite. That's a $589 plus a $1319 all-in-one box. That $589 is going to go after the porphyrins. It's going to improve the overall the inflammatory component that's there, as well as the vascular components that's inside there. The 1319 then goes after the sebaceous gland. It causes an immediate shrinkage of the sebaceous gland, not long-term like some of the other devices that are out there, but it's a short-term, and you see it a change within about a week or so. For me, I use a combination depending on where we are in that person's acne journey, and there's another one that's great that everybody can use. It's an IPL. Most people in their dermatology practice, they have some type of IPL. Maximize the benefit of that IPL, because you can see by using either a 589, a 590, even a KTP laser, we can do amazing techniques to get short-term results for that acne. But again, if you build that person's trust that you know what you're doing, they're willing to be compliant.